Hello, everybody, and welcome to another BALC Leader Spotlight. The BALC is the Behavior Analyst Leadership Council. We are a behavior analysis trade organization founded in 2015. We've done a number of conferences, all in the Northeast. We were scheduled to go to Boston this past year, but the pandemic kind of got in the way. But we are headed to Miami in March of 2022, so we're looking forward to it. So we are committed to supporting behavior and analysts serving as leaders, managers, and business owners. And we do that by offering events through a triad of excellence. First leg would be effective leadership, then clinical acumen, and operational expertise. My name is Jim Hoke. I'm the executive director. And today, we would like to welcome Sara Litvak. She is the Chief Executive Officer of the Behavioral Health Center of Excellence. She has worked previously as a clinical director and an agency owner and an adjunct professor at Pepperdine University's Graduate School of Education and Psychology. Also as a behavioral consultant specializing in quality assurance and OBM projects. So I'd like to welcome Sara.
Hi there. Thanks so much for having me.
No problem. How are you doing today?
I'm good. It's a nice weather here in Los Angeles, so can't complain.
So you're all the way in LA, so we're doing this coast to coast because I'm in Connecticut right now. And there, of course, is lots going on. So the first question I have to ask about, and this is probably because it's on my mind because my daughter went to get her vaccine shot yesterday. So I'm just curious, I had heard LA was not in too good of shape in terms of the virus and the vaccine. So what's going on there?
Well, thankfully it's getting a bit better. I know that our governor just announced that they're doing away with the rating systems for the level of severity, which is exciting. And in LA, the movie business is big. So everyone's pretty excited that movie theaters are opening. So it's definitely looking better.
The movie theaters are actually opening?
Yep.
Wow. That is
at limited capacity, but they are opening.
But life might be getting a little bit closer to normal. I bet that's big in LA because of what you said, the movie industry.
I know the traffic has been bad, so that means something's changing for the better.
All right, so we have some light subjects today. I'll say that facetiously because we're going to be talking about ethics, leadership, and quality assurance, some pretty heavy duty things. But before we get into that, this is about leadership and about people's journeys into leadership. So why don't you tell us a little bit about yourself, where you're from, schooling, how you got to be where you are, pretty much anything you want to share.
Sure. I'll start by saying that I first and foremost am a daughter of first-generation immigrants. So my family moved here from Russia, and I kind of learned English at school because we grew up speaking Russian in the house. And I was really lucky that my parents came here with nothing and really built their lives from the ground up. And I think I learned a lot about what leadership and kind of self-determination looked like from them. They had a family business that I worked in as a young child. They had an electronics company, so I was sitting there like soldering motherboards, in high school, and I was helping with janitorial things. So I was always working from a very young age, and I saw what it meant to work hard very early on in my life. So I'm very lucky that I've had that as an example.
Good. Before you move on, I have to say I always find connections with people that I'm talking to. That my family has at least a heritage that's near Russia, Galicia, and that. And in terms of leadership, I remember from a very young age, the leader of our family was about 4'9", a woman who was my great-great-grandmother who only spoke Russian, and we called her Baba all the time. So yeah. I know that probably doesn't mean a whole lot to people, but that's
it does, because my daughter, she's not speaking quite yet fully, but she calls my mom Baba because she can't say babushka, which is the Russian word for grandmother. So I get it.
I wish I had the picture. I found a picture of her with the rest of us sitting around, but no, I'm not going to make the audience wait for that. Let's move on. So you have that upbringing. tell me about
Yep.
school and interests.
Yeah. So I would say, with my family, education was always incredibly important to my family. So they pushed all of us really hard to study and learn. And I think I learned a lot about thinking critically from kind of that upbringing. Like most families, there was a strong push to go into a trade profession of some sort, like doctor, lawyer, engineer. And so I always loved children growing up, and I really wanted to be a pediatrician. So in undergraduate, I went to Scripps College, which is a women's college that I absolutely adored and met some of my closest friends there. And when I signed up to major in neuroscience and psychology, I thought I'll go become a pediatrician, focus on maybe developmental issues in pediatrics. And on the college campus, they had a clinic called the Claremont Autism Center, and it was in the neighboring school, Claremont McKenna College. And there was a professor there, Marjorie Charlotte Christie, who ran the clinic. And she had done a lot of work in social skills and video modeling, technology-enabled assistance for learning. And she had been running these longitudinal studies on how individuals with autism improve and change over time. And so I just signed up for a college credit class where you could go work at the clinic as part of your class, and you would learn about applied behavior analysis. At the time, I didn't know what that was. And so I started working there as a freshman in college, and very quickly learned to just love the science. My first patient or client at the time was a boy who was incredibly self-injurious. He engaged in a lot of headbanging and aggressive behaviors. And with a lot of hands-on coaching and support with my supervisor, the child made incredible improvement over the year that he was at the clinic. And it was one of those aha moments where I couldn't believe how he behaved when he started at the clinic and how he behaved when he left. And so at that point, I knew, I was still planning to go down the pediatrics route, but I knew that there was something incredibly special in applied behavior analysis.
Yeah, those moments many behavior analysts share. I know that I've had my share of those moments as well. And you mentioned that love for the science, and it just brought me back, because when I was going to school a long time ago, I was a psychology major and I was taking the traditional courses, and I kept having issues with some of the methodologies and the outlooks. It just didn't make sense to me. And then I took a course on behavioral psychology, and it's like, yes, that's it. And I remember that feeling, that loving the science, and then you then learn how it can benefit kids, and that clinical value really hits you. So I appreciate that. Yeah, I'm sorry, I didn't mean to interrupt your story though. So
no, that's okay. I was going to say, but the fun part was that I was a neuroscience major, and I had just planned to go down the medical route. And then about 2 years into, I worked at the Claremont Autism Center for all 4 years of my undergraduate. So by that point, I was really grateful. They had graduate students there, who many of which took me under their wing and, gave me tons of feedback and really shaped, who I am today. Many of them I still keep in touch with today, which is always really fun to kind of look back at that. But so through that, I added psychology as a second major. And then I wanted to apply to medical school. So I took the MCAT and started prepping for all of that. And my professor, Dr. Charlotte Christie, suggested, she's like, hey, you're kind of good at this. Why don't you consider applying to stay on for your PhD at the program? And so I was like, you know what? It's not a bad idea. Let me think about it. And I ended up going and applying and staying on at Claremont Graduate University to kind of pursue my PhD. But what I'll say is that I never finished my PhD. So about 3 years in, so I did 2 years of my master's and started my third year. And by that point, I had worked with Marjorie for 7 years. And I had let her know I was just looking for a change. I think I had kind of learned a lot from her, but felt like I hadn't really had the work experience that I needed to be a really strong behavior analyst. So at that point, I paused the program, and then I ended up going to work in the field. And what I will say is and I'm sure many have experienced this, going from this really controlled, I don't want to say sterile, but like scientific environment where the quality of care is incredibly high, and the students and the workers who are working with those patients and kids are just super well trained and tons of oversight and feedback. And then you're thrown into this world of applied behavior analysis where you go to get a job and no one even checks whether you know what ABA is. And so I applied to a couple different agencies, and at the time I just assumed all agencies are about the same, and I just took the one that could take me soonest because I was out of college and had loans to pay. And they threw me in to a caseload without ever getting any training, and it was incredibly eye-opening. And that was the first time that I realized that the kind of scientist practitioner gap was incredibly wide. Right, you have this kind of academic environment where you're running a bunch of these studies and protocols, and it's what we base a lot of our practice on. And then you go and you see what's actually happening in the field, and the gap is so incredibly wide. That was probably my second aha moment of, wow, there's something here that needs some work. So
I'm seeing a segue here. So we have Sara, who is a brand new behavior analyst, but I'm talking now to the chief executive officer for an agency that is very involved with quality assurance and accreditation. So talk to us about how that became so.
Sure.
How did you get from a newbie basically to somebody who's a leader in the field?
Thanks. Well, so like I said, I kind of got a job at an ABA agency that, I would say was a challenging organization for me to work at for a number of reasons. I was a supervisor, and then, within a year, I moved over to another organization that had one of the largest contracts in Los Angeles for the LA Unified School District. They had about 400 patients they were serving. And what was really exciting about that opportunity was that I was able to be a clinical director. So they kind of were looking for someone who could come in and oversee the entire program. And same thing there. I had a lot of ideas. I was really young, bushy-tailed, bright-eyed, and some of the things that I learned there was that just because you're a BCBA doesn't mean that care is going to look the same across those individuals, right? There's just a wide variety of history and environmental variables that are at play that make you provide a certain type of care. And so it was important to me to try and create some standardization. But what I would say is that I learned a lot about OBM right in undergraduate. And so applying those principles in an organization can be really challenging, especially when there's a lengthy history of doing things a certain way. And so it was a huge challenge for me, running an organization. And at the time, one of my advisors or kind of colleagues, Dr. David Piles, had secured a contract with our state funding scheme. So in California, we have something called a regional center. And the regional centers provide, at the time, there was no ABA autism mandate, right? Many of the parents hadn't come and advocated for insurance reform. So the state, California was one of the most progressive states where they had been covering applied behavior analysis through the state for decades, right? And so that's how many of these ABA agencies first started, was because California had such a robust funding scheme. So when my faculty kind of colleague, Dave Piles, had this contract with the state, he said, the state's really concerned. There's all these providers and they're paying millions and millions of dollars and they don't really understand what they're paying for. And he's like, I need help. Would you want to come support me in this project? I said, absolutely. So I ended up taking on this contract with the regional center. And shortly into that contract, Dr. Piles became department chair of the Chicago school. And he said, I don't really have time for this. He's like, you go for it. So he essentially handed me this contract that he had secured through the Chicago school. And so I was managing the contract on behalf of the Chicago school. And then about a year in, the regional center said, you know what, we just want to contract with you directly, and we'd love to just bring you on and keep this project going. So over the course of 5 years, essentially myself and a couple colleagues, we ended up developing what's called a quality assurance and improvement process for the state. So they identified all these challenges with agencies, and we evaluated, I would say, dozens of organizations across the region. And we would go in and say, this is what the progress report says, what's actually happening in the home. And we would see things like the child's name was incorrect, the wrong gender pronouns, they say the child can't speak, and you go in and the child has like 3 sentences. Mm-hmm.
Were you welcome after that? I mean, when you're coming in and you're showing all of these omissions or areas of improvement, what was the reception?
So I will say that a lot of the work that my colleagues and I have done in quality assurance is getting BCBAs and organizational owners comfortable with peer review. So that was a huge part of it, is the idea of someone coming into your clinic or coming into your center, to your program, and telling you what you needed to improve upon. I wouldn't lie if I said I didn't have people yell at me. I didn't have people tell us we were wrong. I didn't have people, use expletives when we'd point things out. But I would say that's been the journey, not just at the regional center for 5 years, but also at BHCOE, is who are you to tell us what we're doing, right? And I think there's a sense of humility that I think the field has had to have and develop about the quality of care that's being provided, especially as we've moved into this medical model, right? Like, we used to be in this kind of state funded or educational model where, to be honest, ABA was something only wealthy, Caucasian individuals could afford, 30, 40 years ago. And so there was kind of this demand for the type of care that those individuals would want. And many of those parents were the ones that went and fought for insurance reform, which is super important. But now we're in a model where Medicaid services are being provided. We have completely different cultures, completely different needs. There's an immense amount of diversity. And we just can't continue to evolve as a field without quality assurance or some type of oversight system.
That evolution, there's lots of growing pains for behavior analysis. Things have changed. I've been in the field for 30 some years, and it's very different than it was before. So let's talk about BHCOE. When did it actually start? What's its mission? What's the objectives?
Yeah, so BHCOE, as I mentioned, kind of came out of this original project from the regional center. So I like to say that it started in 2009 when that contract was secured, or I guess the theory of it. But when the contract expired in 2014 because of the insurance reform, I went to the state and said, I really want to continue this on. Can we keep doing this? The state was very gracious and said, yes, of course. So we formed in 2015, officially in August of 2015. And we just celebrated our 5-year anniversary, which is really, really exciting. So we're a little bit over 5 years old at this point. And our vision, I'll start with that, is really to create a world where everyone has access to what we call excellent person-centered care. I think this idea of person-centered is incredibly important, where we're putting the patient or the person first in all that we're doing. And I think there's been this kind of big conversation about access, like everyone wants access to care, and access is something that we're always going to be fighting for, or always going to be struggling for, right? 10 years from now, we're still going to have a supply demand challenge, but how do we fix it so that everyone's getting access to quality care? And I think that's something that we really, really strive for as an organization, to make sure that we can provide that.
So how does it actually work, the accreditation? And maybe you can give us a little definition for people out there, maybe like myself, who don't totally understand it.
Yeah, absolutely. So accreditation is really just a peer review process. So it essentially means that some external party has come in and reviewed certain measures. So we look at process, structural, and outcome measures. And those are things like, do you have certain policies in place, or do you have certain ratios that are accurate, like your supervision ratios, right? And then it could also look at outcomes like, are your patients making progress? Are they happy? Are your staff happy? Do you have turnover? So we look at over 100 different data points at this point, and we rely very heavily on the data that we've collected from prior accreditation years, right? So we're consistently iterating in the sense that we're looking at kind of these averages, or kind of norms that we're noticing, and seeing the bar slightly increase, so that ideally we can continuously keep pushing the field forward little by little. And so the process is, I would say, it's very vulnerable. As I mentioned, there's a sense of humility that has to happen, and I always commend all of the organizations that do that, because you really are, lifting up the hood of your car and saying, come take a look, and we're going to kind of let you do your thing, and we're going to take what you give us and say, oh, interesting, we didn't see that, but you do, and that's the reality of what you see, so let's figure out how we can bridge that gap. So it's not a slap on the wrist. It's not a, it's not a negative process. It's a coaching process. And it's a coaching process we've been doing for a long time at this point, 10 years, if you count our regional center days, right? So we know what we're doing. our staff are incredibly well trained. They're incredibly professional. And they're all of our evaluators are just incredible people. They're people who I, love spending time with just because they're really good humans, but they're also really well trained. They've either owned agencies on their own and decided it's not for them, but they love the field, or they've been in senior leadership roles in ABA organizations, so they really know the ins and outs of that. But yeah, it's a fun process. And you asked me about our mission, and I think that's a really important thing to mention as well. Is as we're growing, we recently just kind of launched a new mission statement, actually. And one of the things we wanted to think about is, what are we really doing in applied behavior analysis, and what's important to us as an organization? And I mentioned the person-centered approach, which I think is really important. But the second piece that's important is that we really want to establish performance-based standards. That's what we've been doing. I think that we have a set of standards that have existed for the last 5 years, but they're not guidelines, right? Like guidelines and I think, best practices are very different. We have what are called standards, and it's very different than those other terms. We want to increase access to quality care. And then I think the last piece that's been really important, and I love this about BALC because I know that Suzanne Lutzow, the founder of BALC, feels really strongly about this, is our goal is really to increase community collaboration. So we try and have no ego over who's doing what in our field. We just want the field to grow and improve and be better. We are one of those organizations trying to do that, but we know that there's many organizations trying to do that as well. And we would love to be able to bridge some of the gaps that are existing across those.
You are right. The organizations do have that in common. That's one of the BALC's goals as well. But as you were talking about lifting up the hood and have somebody looking into your car and seeing what's there, let me just say, I have this company, it's fictitious right now, but it's GBA, Great Behavior Analysis, and it's pretty successful. Why would I have you come? Why would I want accreditation? I'm assuming I would have to pay for it. So what is my motivation? Why would I do that?
Yeah, I think it depends, right? Every organization is different, but there's some organizations that say we just want to start it right? Like we know we're going to grow and we don't know what we don't know. And some people have built in quality assurance and integrity checks into their culture. So they're just, this is just the reality. There's some organizations, we just released our annual report, which we do every year. And in that report, if you're interested in it, it's just on our website. There's some really amazing stories about organizations who've done that. So they've said, this is an important part of who we are. It's a core of our ecosystem as an organization. And so there's no world where we won't go and get accredited, right? Because we're just believing that that's a key and integral part of our organization. So you kind of have that camp of people. And then you have organizations, unfortunately, who might have gone through a really negative experience. Maybe they had a complaint filed against them. Maybe they had a disciplinary issue. Maybe they had a payer audit come through. And so them saying, gosh, I didn't realize this was happening. And how could I have, right? Because we didn't have those checks. And so sometimes we do get those organizations who come like mea culpa, like, hey, we realized we had these issues and we're trying to improve. And then we also have organizations where, they say, we understand that accreditation's nice to have right now, but we know payers are already talking about value-based care. And they're already talking about, tightening the restrictions on what providers can do. And so they want to be ahead of the curve. I kind of equate it to the RBT. There was a time where the RBT was a nice to have, and now it's a must have, right? And I think that's the same thing with accreditation. We've already seen some payers start to require it. And we've already seen some payers who are starting to base value-based care arrangements or increased insurance reimbursement rates based on whether you're accredited or not. So there's kind of all of those factors happening that could draw someone in.
Yeah, and my question wasn't, my viewpoint is that you should do that. When I worked for an agency before, I would bring in external people to do a review, to provide feedback. I think it's a good thing to do for your service. It's actually a good thing to do for marketing, to say that you bring somebody else in, to take a look at everything and see how things are going. So I think that's fantastic. So when the pandemic hit, did you have to shuffle a bit from BHCOE or even personally? I'm just curious.
Oh my goodness. Absolutely. I mean, who didn't, right? So I would say actually, I need to, I need to say a huge thanks to a lot of people. But when the pandemic hit, I'll be honest with you, we were quite nervous because, like I mentioned, accreditation was something that's a nice to have, not a must have. And there was a point, and just too, we've been like bootstrapping BHCOE, right? So myself, I've put in a lot of my personal time and energy and resources into the organization, and so we've never been an organization that's been just kind of able to pull where we work hard every single day to show up for our providers. And so when the pandemic hit, we were really nervous that if organizations are focused on COVID and they're not going to be really, focused on accreditation, that we might, go out of business. And I'll be honest with you, there was a call with our scientific advisory board where I was crying and saying, I think I have to furlough everyone, because if people don't pay us, we're not going to be able to be around in 3 months. And that was a risk that I had to take, furloughing people, because we wanted BHCOE to sustain. And so we at the time had 9 employees, and we did, had have to furlough all but I believe 3 of us. But the exciting part is that we decided that the minute that happened, we would spend the rest of those 2 months showing up for our community, right? So we had no other agenda other than putting our providers first and making sure they had all the resources and time and kind of all the information they needed to be successful through this. And so the exciting part was that we had a number of organizations who contributed to individual membership in different ways that allowed us to sustain. And thankfully, 3 months in, we were able to bring all of our employees back. We actually just repaid them. We repaid them when we brought them back in July for all of the hours they didn't work, right? So we were able to make them whole for the year. And I would say it was one of the most challenging things I've had to experience as a leader, but also one of the things I'm most proud of, because I think, no one wants to be in a place where they're nervous about, all their employees, continuing to work. And so I was really excited that we could do that for them. And then since then, we've been able to just grow incredibly. It was a year to really look at who are we, what are we really doing, what are we really trying to accomplish, and how can we get there in this time where time is really on our side, because everyone has to become really laser focused on their mission and what they're doing if they're going to be successful through times like this.
All right. Is there anything new, anything next that we should tell everybody about what to look forward to for
Oh gosh.
BHCOE?
Yeah, there's so much exciting stuff down the road, and I know our accredited organizations hear about it all the time. But I think the first piece that's exciting is we we launched our measure development group. We have a really exciting process for developing standardized measures for the field in a way that's done in a pretty, I would say, intricate fashion. We also have some exciting pilot projects coming up for our providers, so related to outcomes. We have some new standards that we're going to be releasing hopefully at the end of the year, so I'm excited for that. It's not going to be related to the full accreditation. I won't give too much away. And we just have, I would say, a really robust amount of benefits that we're offering. We have these wonderful learning opportunities every month. We've launched our peer mentorship clusters, and we have some just exciting stuff going on the payer side as well. So it's all the things we've done before, but I would say it's a refined and just fresh, and we have some really exciting team members who are leading some of these initiatives.
Sarah, it sounds like you and the BHCOE are doing a great job with leadership here in the field, and Lord knows we need it coming out of what we're coming out of. Everybody's been shaken. BALC's been shaken a little bit because of of the economy and everything, and we've been trying to stay relevant, just like you are out there in the field. So hopefully we're going to get into a period that's a little bit more normal. I appreciate you joining me today on this spotlight. Before we end, I was thinking, do you want to show the website for BHCOE before we?
Oh, sure. I'd be happy to. Let me pull that up quickly. Yep, absolutely. I was gonna just say, if you are interested in learning more about BHCOE, let me pull this up here. This is our website. And I was just mentioning, if you want to go see our annual report, you can go to forms and reports here. And these are all of our standards. We have a standard for documentation and our crosswalk. And then this is our annual report down here. So just came out, check it out. It's really exciting, chock full of information. And I hope you all enjoy it.
Great. So hopefully Sarah and I will be talking more to figure out if there's any ways the BALC and BHCOE could collaborate in the future. So please stay tuned. And if I can here, let's hold on. I'm going to share our final screens. I want to thank everybody for attending this Leader Spotlight from the Behavior Analyst Leadership Council. We want to make sure that everybody is staying safe, and please be well out there. So take care, everybody.